Michael, welcome to the North Pole. Thanks so much for joining us here.
Got my tree up for you, Santa. Thanks. I like your snowflakes on your jacket and your red tie, of course. If I'd known that the theme was Christmas, I would have dressed up myself. But it's a pleasure to be meeting you today virtually. Thanks for inviting me.
Absolutely. Well, I don't know if you have any eye ornaments on your tree, but this little snowflake here at the top has a little eye in it. So we're trying to stay on the ophthalmic theme here.
That's very good. I don't know. My wife and I are both ophthalmologists, and it wouldn't surprise me if something up there had an eye motif.
Michael, tell me a little bit about modernizing medicine and where are your markets around the globe?
Sure. So currently, we are a U.S.-based company. As I said, in South Florida, in Boca Raton, Florida, we have about 900 employees, and we are just a few months over 10 years old.
Okay.
Modernizing Medicine delivers software to physicians, currently only in the United States, although we do have some interest in delivering internationally in the future. Our company is based on verticals, so that a vertical takes care of a certain type of doctor. So as an example, I'm one of the executives and the director of ophthalmology. Ophthalmology is our second biggest vertical and the fastest growing. The founder, one of the co-founders, is a dermatologist. So obviously the software was written for dermatology to begin with. And in fact, in the United States, we have about 70% market share in private practice dermatology. We also take care of orthopedics, GI, plastics, several other verticals. And our goal is to provide software to medical practices so they can run their business more efficiently. And that software could be EHR, practice management, patient engagement, image management, et cetera, et cetera.
I would imagine with the competition in the United States over this issue, that there would be a lot of innovation going on there. You know, each group kind of pushing the next, how to develop and innovate. And so if we take a view of innovation and think about that globally, what do you see as the trends happening now and into the future, 2021 and beyond, with EHR?
Well, it's actually interesting. There isn't as much innovation as you would think.
Okay.
And the reason has to do with the fact that most of the electronic health record vendors in the United States started 20 or 25 years ago. When you talk about hospital systems, for instance, the big gorilla is a company called Epic, which is a privately held company in Wisconsin. And they have over 50% market share for delivering patient record software to hospitals. Cerner is another big player in that term. Those are companies that are 20, 25 years old. In electronic health records, you've got companies such as eClinicalWorks, or you have companies such as Allscripts. These are companies that developed platforms using old technology. Specifically, they use old client-server databases.
Okay.
And it's only been in the last 10 years that cloud-based systems have really started to come to the forefront. In fact, that's the sweet spot for our company. Our company has a native cloud-based application. We can leverage that on the web so that as long as somebody can open a browser, they can access our database. We also have an app for the iPad for clinicians to enter data. We have an app for their phones so they can access data anytime, anywhere. They have an app for patients so patients can access the system, request reminders, receive reminders, request prescription refills. So that level of technology is slowly entering the medical space because the existing players aren't spending the money to retool their old client-server technology.
I see.
So innovation is less than you would expect in this market.
Michael, you've talked about data in the cloud, and I can tell you there's a lot of clouds here in the North Pole because it snows a lot. But for viewers that don't know about this kind of thing,
Sure.
What's the difference between the cloud and a client server, for example, when it comes to data?
Certainly. So, client server technology is a type of storage where there is a computer with a large hard drive that's called a server.
Yeah.
That server contains all the data. In this case, it would contain all the information in the electronic health record and the practice management. That server could be in the back office. Santa's helpers could be in the back, making sure that it keeps running,
Right.
but it's a physical server and it's physically located in a location. There's a variation of this where that server is put in the cloud, but it's still a single point, and that single point has to be maintained. So that if I'm a company that delivers client server technology, every client, I have to touch their particular server, update their software, make sure their software works well. So it's a system that is worked well 25 years ago, and it was state of the art 25 years ago. But besides the fact that you've got multiple servers that you're now monitoring, you don't have a single data set. And obviously, data is king. We all now know how important data is. Well, when you have a cloud-based database, there are two major advantages. The first is it's one application. So when we update our software, which we do quite frequently, we have a major update every 3 months. We just need to update it in one location in the cloud, and all of our clients have access to it immediately. And this is just the way that you update your software on your phones. Those are all native cloud-based applications. And the additional benefit is that the data resides in one location in the cloud, so that we have clients who have 500 doctors. They have access to all 500 doctors, even though they're in multiple states and multiple locations all over the country. They can access that single data set, and they can derive benefit from analyzing that data set. And internally, we can analyze that data set. We can look, for instance, I run a report where I look at how our users all across the ophthalmology platform are using our software. And then we can get that feedback to our product development team and fine tune our software if there are areas that aren't working well for our clients. So a new cloud-based application has huge advantages when you're running a business, a software business. It also helps the clients. In the United States, there's a number of private equity investors who are buying medical practices. Some of these large companies are backed by a private equity management team and private equity funding. And they want to slice and dice their data to understand both the financial side and also the healthcare delivery side of that medical business. And having a cloud-based database lets them do that. So larger clients especially love the fact that the data is in the cloud and can be accessed and evaluated very easily.
Well, as someone who's attended the All India Ophthalmological Conference since the early 2010s and has walked by every exhibition booth of hundreds, I can say with certainty I've never seen an EHR booth. So I think that the market would probably be primed for you. And I would wish you all the best internationally and in the domestic U.S. Thanks so much for joining us. And I think I hear, well, it's not exactly Santa's sleigh, it's just a cowbell. But anyway, the reindeers are in the works. Thank you, Michael, for joining us on the program. We've been delighted to have you here and learn about EHR, both domestically and globally.
Thank you very much for inviting me.
Absolutely.